Hey ladies, what's going on? So I'm coming to you with a over 2 week update. And so I just wanted to let you ladies know how I am doing with being a full-time mommy with Symphony. Right now she's sleeping. It's 11:33 p.m. What's today? I, I'm always forgetting today's day. Today is Tuesday, August the 11th. So Sunday, Monday, Tuesday. So it makes it 2 weeks and 2 days that I've been a full-time mommy. And let me just tell you some of my experiences that I've been having and some of my fears and how I am doing with nursing. First of all, I finally went ahead, I want to say about 4 days ago, I went ahead and took my bandages off of my C-section. And I'll probably show you guys how the scarring and everything looks sometime this week or whatever. But it looks really good. Actually, you really can't see it like that. So I'm really happy about that. Let me see if I got a photo of it. I don't know if you guys can see this, but you really can't see the scarring too much. I think that the doctor did a really good job because if you notice, like, this is the scar right here. But I'll do one more so you can see it up close. But I'm really happy. It's very low, bikini cut. And I did go ahead and I did order the gel, Ricido or Ricado tropical gel. I went ahead and put in my prescription for this. Now, my insurance did not cover this. I don't know if it's because this is a new gel, but it's basically very thick. And it's a self-drying tropical gel for old or new scars. It may prevent excessive or abnormal scar formation. Patent silicone gel formulation, and it reduces redness, itch, and discomfort associated with scars. Soften and flattens raised scars caused by surgery or injury. So this is perfect. I think I already told you ladies how I came across this. I went into my doctor's office and bottom line, you know how they have the pharmaceutical people there, so they were giving out samples, and so I asked my doctor to actually give me a prescription. They also had gave me some discount cards. This was actually like $200, okay? And again, my insurance did not cover it, but with the discounted card, I got this for 40 bucks. So I said, hey, it doesn't hurt to try it. And I'm actually going to try this with my C-section, I'm already just trying it with my C-section car, but I'm gonna also try it as well with my stretch marks. Um, so this is great. So I have been using this. Do I see a difference? Not really, because I really can't see the C-section scar that well anyway, but I'm going to use it on my other scars, like my TAC scars, because it says anything that keloid up or whatever like that, this stuff really helps flatten it and reduces, um, try to help disappear or whatever like that. So why not? So anyway, let me get back to what's going on. Okay, so far as nursing with Symphony, everything has been going great. Um, Usually she would stay up until like probably about a good 1, maybe 12 o'clock midnight. But she just ate. One thing that I do notice about Symphony is that she feeds for a very long time. It can be from 45 minutes to maybe up to 3 hours. And I do produce a lot of milk. I know I do. I think my baby has really been overfeeding herself because sometimes, I try to burp her and she does burp. But I've noticed lately that when she lays down, she really throws up the milk. It's a lot of milk. And it happens once in the blue moon, but it's enough for me to have to put a bib over her and just keep a watch out on her while she's sleeping and stuff like that. Um, Also, too, on Friday, last Friday, we had to go to the pediatrician because on Thursday I noticed that her right eye started to what's the word? You know how you get coal in your eye? So it started to crust up around it. And I was like, what is this? So I would wipe it off with a warm washcloth, hot water and stuff, nice for the touch. And I would clean it off and it would crust again. And I noticed a little bit of yellowness that was coming out. So I said, wait a minute. So I called the doctor. I looked it up online and they were saying sometimes that newborns, their tear ducts can get clogged up, and that's very common. So I called her pediatrician and we went in the next day and he gave me an antibiotic ointment to put over her right eye. So I have been using this antibiotic ointment. Um, and so I have to put this over her eye every 6 times a day. And so far it's clearing up. He when we went for her 2 week checkup, which was Monday, he said everything looks really good and by Friday it should be totally clear. So I'm really happy about that because that really had me nervous. Um, when she was born, she was 5 pounds and 6 ounces. But when we left the hospital, she was 4 pounds and 16 ounces. When we went Friday, she was 5'6", and then when we went again on Monday, she was 5'9". So he said she should be gaining an ounce every day, and she's actually on target. Um, the only thing that she really wants to do, Symphony really wants to do, is sleep, drink, sleep. She may wake up, look around a little bit. She's very alert, and she wants to drink and sleep. What I found that was very sorry, y'all, I'm just in and out of it right now. What I found that really helped me out today was that I was able to put her in the carrier around the house. So she was nursing on my boob while I'm carrying her around, and she didn't seem to care. So that helped me to be able to get around and do a little bit more with my daily routine. One thing that I have noticed about being a new mom is that you just can't get up and go like you used to, and you can't, there's certain places that you just can't really bring and take the baby, especially a newborn. So remember I was telling you guys that there was going to be this huge sale coming up where you had to pack all of these clothes into the bag, and if you can fit all of these clothes into the bag, you can walk away. Well, you would pay $15 for the bag, right? And I went to this sale in the beginning of the summertime. So they had another one this time. And so I was like, yes, I got to get up. First of all, the sale started at 11. When I looked at the time, it's 10:50. Any other time I can hurry up and wash up and jump in the car and go. But no, I had to make sure I nursed her, make sure I burped her, make sure I had everything packed. Then when I got in the car, she was still a little fussy. And y'all, when I pulled up to the sale, everybody was already there before the time. So I'm like, oh, I'm not even early. So I had to park a block up. I had her in my hand and I'm nursing her while I'm pushing the stroller with the nursing cover over, and it's hot as the dickens outside. And I'm going and I'm trying to go all through these clothes and look for something nice, and the whole time I'm nursing her, then I put her back in the stroller. My baby looked like she's sweating. It's just so much just going on. And then I was able to fill up one good bag with a bunch of clothes and everything like that. So I go in and I ask for another bag, and then I just thought about it like, Mona, it's too hot. Baby don't need to be out here. She's going to get fussy if she's not all the way satisfied with the milk that she got. It's time to roll. Let's just let it go. So I just said, you know what? I'm done. So I took the bag and I went on home, and I learned a valuable lesson that I just can't up and do what I'm used to doing, and that's what comes with the territory. Um, Also, too, I have not utilized any of my cloth diapers yet, and the reason why is because as soon as I feed her, she poops. So the other day I was gonna go ahead and say, yeah, I'm doing my cloth diapers, but then I realized, Mona, you're about to be going out, and I heard it's more is you rather use if you're gonna be traveling, you want to go ahead and use disposables worth um disposables more than cloth diapers. So I haven't been able to utilize that, but I want to try to tomorrow just to see how it's going to go. So far, my favorite brand of diapers would be um, Pampers. They're a little bit more thicker than Huggies, and they're just a little bit more thicker than Huggies. I mean, when she goes, she poops. I mean, she just goes, and I feel like with Huggies, it's a little bit. It doesn't hold everything in. Right now, she's still in her newborn diaper, so we're going on 2 weeks right now, and she's still in her newborn. She's smiling right now. So yeah. Also too, I'm not sure if I told you ladies this, but I was told that I think I might have told you guys this last time that when I'm breastfeeding her, to give her drops of vitamin D. Uh, Let me see if I can show you. Gosh, why isn't this coming out? The vitamin D, and this is liquid vitamin D supplement, the Enfamil. Her pediatrician actually gave me this. This is actually really a sample, but when it runs out, I'll be going to CVS Pharmacy to buy some. But I put a little bit, like when she's nursing, I just put it on the side of her mouth while she's on the boob. Oh, she's laughing. Oh, that's cute. What you think about angels? She's sleeping right now. But yeah, so she doesn't have any problem with taking it while she's drinking, and she's just like, I don't care, just as long as she can drink. Um, oh yeah, I gotta show you this too, and let me show you. Y'all, this is so cute. But I got this cute little hamper, and I think this is awesome because when her clothes are dirty, because I wash her clothes separately from our clothes, I can just take her dirty clothes and just, throw them right in the hamper. And that way I know where all of her things are. And that helps keeps a lot of things situated and everything like that. Yeah. So other than that, I really enjoy being a mother. I really do. It's so crazy because like today she had on this cute little outfit, and she had a bib that said "I love mommy," and I just realized I'm mommy. She gonna be calling me mommy soon, and it's crazy because my cousin, y'all should have seen my hair a couple of days ago. I had an afro, and my cousin came up and was like, "Mona, let me put your hair in some twists." So she put my hair in twists. Shout out to you, Nikki. Thank you so much. Because, girl, I can get up and go and do what I can do. Do what I do. But, anyway, where was I going? Oh, yeah. I went with my cousin house, too. And, I remember saying something to Symphony, and I was about to say, well, Auntie want to do this. And I was like, I'm so used to saying Auntie, like referring to me as Auntie, that I have to get used to me saying Mommy, Mommy, Mommy. So, yeah, this is one thing that's been really incredible is just to know that I am a mother. And just making sure everything is situated and things are put into play for her. But I am definitely enjoying it. Sending out thank you notes to people who've sent out gifts and everything like that, and the baby shower. Um, she has not been sleeping in the bassinet, nor her crib, or the Moses basket, or anything like that. Symphony has been co-sleeping with us, and she just lays there like Sleeping Beauty, and she's content, and that's about it. I'm trying to figure out, am I forgetting anything else? That's pretty much it. I actually really should be getting to bed because she may wake up and I may not have time to rest. Right now, because I am solely breastfeeding, it's hard for us, like, Matthew jumping in and helping out because she's on the boob. But what we've decided to do is that, like, in the morning when I'm breastfeeding her and I'm done, I give her over to her daddy so he can pat her back and burp her and walk her and rock her around and everything until she's back to sleep. Because newborns at this stage right now, the only thing they're doing is sleeping. Um, and I do feel drained and tired, and yeah. I do feel like I have been losing weight. Maybe I just feel like I have been losing weight. Like today, I had a burst of energy. I felt like I can do any and everything, and I was so ready to do that. Um, yeah. And the only thing like I said, I just stare at her and make sure that she's tilted the right way, she's laying the right way, just in case if she throws up or anything like that. I have learned to nurse her while I'm actually laying down, like, laying on your side while she has the boob, because it'll be times when I'm just so tired. And she would just fall asleep nursing, and I'll be just half sleeping too. Um, but so far, everything is perfect. Everything is perfect. I still have to send, I'll be sending my thank you letter to Dr. Davis. I just can't believe it's 2 weeks already. It's going by so quick. So I've been trying to take photos of her and video footage of her, like, as many times as I can, because my baby is starting to get bigger. And I'm just like, oh my gosh. I was thinking, am I going to miss this? Y'all, let me show you this cute little picture of her. She's just so cute with her I love mommy on. I sent her the photo to her daddy. It was like, she threw up and I had to change her outfit today. So it's little things like that that I'm just so grateful for. Um, and I just still can't believe, I'm like, this is my little girl. This is my baby. And reflecting back on everything is just crazy. So, what's next? So, on the 30th, at the end of this month, she has her second hepatitis B shot that she has to get, or vaccine, or whatever. I've been really trying to look up, like, far as these vaccinations and stuff, because I don't want my baby to be over whatever with too many vaccinations. And I know some vaccinations you definitely, definitely need. But with all vaccinations, you need to look up what they are for and what they're for, pretty much. And you also need to know too, like, if there's any side effects. So I'm trying to educate myself with that as well. I've also been trying to look up, how often does a baby actually breastfeed. My pediatrician told me that she should be breastfeeding every hour. That's not true. Should I wake her up now? Hey you. Hey you, peeking time. Hey, peeking time. She ain't trying to wake up. But he said every hour. So I try to wake her up. And if she doesn't get up, I mean, eventually she will get up. And if she doesn't feed on that hour and wake up the next hour, trust me, she going to feed for about a good 2 hours. Um, so I do feel like she is gaining weight. I feel like she is gaining weight. And she is eating a lot. I do feel like she eats for a very long time though, and she does get fussy. I'm trying to see. Let me see. Hi, Pekin Time. Hi, Pekin Time. So I do feel like she's gaining weight, but she's so tired right now. And the way she lets me know when she's hungry is when she does this. Hi, Pekin Time. You know what she. And sometimes I try to get her up because like right now it's 11:54 p.m. So if I can get her up and get her to feed, then she may just go ahead and eat for a good minute, and then she can go back to bed. So I wouldn't be up all night long. Hi, baby. Hi. Are you hungry? Are you hungry? She like, did I tell you I was hungry? Are you hungry? Are you? You want to say hi to the ladies? Say hi. Hi. Say hi. Say thank you for praying for me. Hi, Pink and Time. And see how she snap her lips in about 5.2 seconds. She about to be like, where's the milk? Hi. Hi, Pink and Time. Did you sleep good? Yeah, so yeah, I have to keep a bib on her because sometimes what I don't want her to do is to be throwing up and everything. Hi, baby. Hi. And I do feel like she is starting to gain weight. Oh, somebody's tired. Woke you up from your beauty sleep. I woke you up. And it's amazing when she starts staring. You be like, what is she look? What are you looking at? What are you looking at? But yeah, she's getting to the point where yeah. I'm always checking her hands to see if they're too cold. I'm checking her head for fever. If she sneezes, I'm like, what are you sneezing about? If she cough, I'm like, oh gosh. I'm not gonna say I'm a big hypochondriac, but yeah. And see, like right now, she's ready to eat. You ready to eat? That's what babies do when they're ready to eat. They looking for the boob. You ready to eat? You ready to eat like a Peking time? Yeah. So we had an issue before with her latching, but again, like I said, she's been really doing very, very well with her latching. So I haven't had an issue at all with getting her on both boobs or whatever. So I would say in a month and some change is when I'm really going to start like pumping. And because what I want her to do is get her latch packed down, and I also want to make sure as well that her dad is able to give her a bottle or somebody else is able to give her a bottle without me feeling like, oh gosh, I'm her only outlet to food. Look at that. You say I'm ready to eat now. You woke me up. So, you want some food? So, so yeah. Look at her. Now she about to spaz. Come on, let's go get you yeah, so other than that, um that's pretty much it. So okay. So yeah, ladies, so this is basically my update. Hold on, y'all. Hold Well, that's pretty much my update, y'all. So let me go ahead. I'm gonna nurse her. All right, okay. I'm gonna go ahead and nurse her or whatever like that. I'm telling you, she wake up and the first thing she's like is, okay, it's good to see you, but where's the milk? She really don't care too much. But I'll be giving you ladies another update. But until then, ta-ta for